Story 1. I was confused and groggy, experiencing a lot of pain. However, I was supposed to be dead, so it felt like a significant win at the time. Story 2. I felt disoriented and couldn't remember who or where I was for a few minutes. I felt extremely groggy, as if I had a severe hangover, but without the nausea or pounding headache. My first thought was, am I in Colorado? Then I realized I was in a hospital but didn't know why I was there. I am in Mississippi, and unless my parents drove through Colorado when I was a little kid, I have never been there. Story 3. I was in a medically induced coma for 2 weeks. It was just blackness and nothingness. After waking up, I was weak and had lost about 80 pounds, was confused, and experienced severe hallucinations for several days. It took months of physical therapy and counseling to get back to normal. I definitely do not recommend it. Story 4. I spent about 7 weeks at the end of 2021 in the intensive care unit. I had perforated diverticulitis. After the first 2 surgeries to remove my intestines, I went into septic shock and developed pneumonia. My organs started to fail. I spent 14 days in a medically induced coma. I was on a ventilator and had a feeding tube inserted through my nose. It's a long story. I have many memories that felt real to me, but they never actually happened. I believed I was living on a houseboat for a long time. I thought my ex-wife had adopted a set of twins from Australia. I remember a stranger living in the air ducts who was trying to poison me. I thought I had become a local sports news anchor who got away with cursing frequently. Strangers could walk on the walls and ceilings, but I could not. I believed I was in a hospital for prisoners due to plagiarism charges. I also remember dying in a house fire and another incident where I drowned while on public transport. Those are just some examples. When I woke up, it took me days to realize I had a colostomy. It honestly took me months to sort out what really happened and what did not. It was also months before I could actually walk again. Maybe septic shock contributed to my distorted memories, but I was also heavily medicated. I have many of those memories noted on my notes app. I am very thankful to the doctors at Parkland Hospital in Dallas. Story 5. I was hit hard by the early alpha wave of COVID-19. In March and April 2020, I spent 38 days in the hospital, 16 of those in the intensive care unit on a ventilator. The thing about being on a ventilator is that they have to administer heavy sedatives, which cause what are known as ICU nightmares, non-stop vivid hallucinations. I experienced these for 16 days straight. Thankfully, when I woke up, I don't remember much from that time. They do not take you off the ventilator until you can maintain breathing and oxygen levels on your own. Once you can do that, they remove the ventilator and stop administering heavy sedatives, which take a few hours to wear off. I recall them asking me orientation questions. What is your name? Do you know where you are? Do you know why you're here? Initially, I mistakenly answered that I was in a veterinary clinic, which was clearly incorrect. Then, I thought I was in a hospital in another town, still wrong. Eventually, I answered all 3 questions correctly. When I woke up, I couldn't walk or talk. I had lost 12 pounds after being horizontal in the intensive care unit for so long, and I experienced significant shaking in my hands, making it difficult to use my smartphone. It took a few days to reach a point where I could communicate with others and perform simple tasks, such as pushing the nurse call button on my bed. Even after all that, I still had 4 tubes in me: a catheter, a 3-port neck intravenous line, a nasal feeding tube, and a nasal oxygen line. It took some time to have all those removed. It was a surreal experience. Felt as if I had been completely rebooted. It also reminded me of the old phrase, you never know how strong you can be until being strong is your only choice. Story 6. I was in a coma for weeks due to meningoencephalitis when I was 8. As I was coming out of it, it felt like the worst hangover of my life, headache and all, which aligns with the diagnosis. There was no dreaming. I didn't hear anything going on around me. It was just a long, dark, deep sleep. I had to relearn almost all motor skills, but muscle memory is an incredible thing, and I recovered remarkably well. Story 7. It's not like it is in the movies. It's violent, scary, and ugly. An intoxicated driver put me into an 11-and-a-half-day coma in the intensive care unit. I lost about 40 pounds during that time due to atrophy. I woke up angry, violent, bruised, bloody, irrational, and fragile, which is not unusual. I suffered a traumatic brain injury, as well as a broken sternum, skull, and shoulder. I haven't been able to taste or smell anything for over 12 years. This changed the momentum of my life up until that point and caused new stress and heartache. Since then, things have improved significantly. I discovered music composition therapy during my recovery and dedicated many years to writing music afterward. If you're interested, the album 9FM by the artist 9FM features the music I created during my recovery. It's a silver lining, I guess. However, the coma experience was truly disturbing and not at all like we have been led to believe. Story 8. When my dad and I visited my aunt, who had been in a coma for 3 months, she shared her experiences during that time. She described walking in a dark tunnel with a bright light at the end. Most of the time, she felt scared and trapped in a loop of nightmares. Story 9. My husband saw me, his sister, and his brother-in-law standing next to him. He was in bed at the hospital. He thought he had passed away and that we were at his funeral. He couldn't talk at first, but he could write. He was very confused, and the previous 14 days were a complete blank. Story 10. I wouldn't call it a coma, but I did get hit by a truck while riding my motorcycle. I woke up 3 days later in the hospital, very disoriented and confused. I didn't see anyone immediately, so I started yelling because I thought I might be having a bad dream. It took about 4 hours for everything to come back and work properly, but I couldn't remember what had happened. Story 11. I have been in 2 comas in 2 years. One lasted 3 days, and the second lasted 9 days. When I came out of the first coma, I regained full consciousness as they were removing my central line. It felt strange pulling on my neck as I opened my eyes. The nurse asked if I knew what happened, and I said, I collapsed in a laundromat? She simply replied, no, and left the room. I don't specifically remember waking up from the second coma, but I was conscious on the ventilator for 24 hours, which was a nightmare. You are constantly choking but have to relax because it won't stop. During both comas, it was nothing but blackness. Like a blink, and suddenly I found myself in a hospital bed. Story 12. I've talked to patients who woke up from a coma. They remember conversations that were occurring while they were in the coma, so be careful what you say while you think they aren't listening. I had a couple of people tell me it felt like one really long dream. Story 13. My dad was in a coma for a little over a week. When he woke up, he was totally disoriented. He managed to say, I want to see my wife, and then spent the next hour just drooling and appearing intoxicated. Once he finally gathered himself, he described it as a really deep sleep. He was aware of nothing while he was unconscious. He remembered being at the lake sitting on the shore, and his next memory was waking up in the hospital. In between, there was nothing, and when he woke up, he felt completely disoriented. Story 14. I just woke up from a 3-day coma after experiencing several seizures a week ago. Everything felt strange. I recognized everyone in the hospital, as if I knew them. It felt like a dream, and I didn't want to eat, but I was very thirsty. My head hurt, and my thoughts were muddled. Story 15. I gradually started to become aware of my surroundings. I knew I was in the hospital and had some understanding of what had happened, but I didn't know the full extent of the procedures I had undergone until I regained awareness. I knew I had a tracheostomy, but it wasn't until I was transferred to a skilled nursing facility that I noticed I had a feeding tube. I discovered this when the night shift nurse came in to give me my medications and flushed my feeding tube. I asked her, "What's that? Is that a feeding tube? How did I not know about that?" I don't recall much of my first few days at the skilled nursing facility, but the certified nursing assistants who were there said I was pretty out of it and that they were scared to touch me since I was missing the right side of my skull. I was in a medically induced coma for 2 weeks following brain surgery after a hemorrhagic stroke. Story 16. I was in a coma for just over a month, and it was day by day to see if I would survive. It took me around 2 to 3 weeks to fully wake up, and it was not a pleasant experience. A lot of the time, I thought the nurses were harming me, when in reality they were changing my tubes and adjusting my trachea. I had many experiences that I now recognize as dreams, but I look back on them more as memories because they felt so real at the time. I also had some spiritual experiences, like being able to see younger versions of myself, which was very strange. I was delirious at the time due to medication and illness, but I still remember standing on a balcony with the doctors and nurses discussing how I hoped they could make me better. This didn't happen, of course, but even now, looking back, it feels real. If anyone has a specific question, I don't mind answering, as it is a surreal experience and people ask me about it often. Story 17, hands down, the most strange thing I've ever gone through was not knowing why I was in the intensive care unit ICU in the first place. I didn't realize where I was. I was actually convinced I was lying in my living room at home and overall unable to process what was happening. It took me nearly a week of being informed by doctors and family members about what had happened to finally comprehend the time frame of everything. On another note, the hallucinations I experienced during the coma when my sedation was slightly lifted were the most terrifying thing I have ever encountered. I believed I was dead and that this was some sort of purgatory, likely a result of being on a ventilator and receiving high doses of medication to keep me alive. I still haven't fully processed everything. Story 18. For me, it was like turning a light switch on and off. One moment I was driving, and the next I was in an unfamiliar bed in an unfamiliar room. I couldn't make sense of anything, and my head hurt. I felt confused, suspicious, and a little angry. I knew I wanted to leave immediately, but I had no destination in mind. I struggled to make my body do anything helpful and almost fell out of bed. It was unpleasant and frightening. I was told I was dead for several minutes before reaching the hospital while being cut out of the vehicle. It's impossible to know how long I was dead. I am still haunted by the absence of anything resembling an afterlife or the near-death experiences often described. It was just non-existence. This makes me question whether those other stories are simply lies or fictions people create to escape the void. Perhaps there is a difference between a traumatic brain injury coma and others. It's been almost 20 years, and there are still moments when the world blinks out or feels different, leaving me to wonder if I might still be in a coma. It's hard to describe. Story 19. My boyfriend was in a coma for over a week after being shot in the head. The doctors were unsure if he would remember anything or how much it affected his brain function. It was hard for him to talk after being intubated. He could barely make any sound with his voice, and his handwriting was illegible. He was very frustrated and literally couldn't get any words out. It turned out that one of his vocal cords was paralyzed from the tube. He struggled to talk for some time. He eventually had surgery, and his voice is fine now. He says he doesn't remember anything from his coma, which is surprising because when the medication was low, you could see his eyes open and wanting to express himself, but he couldn't. Story 20. I came to with my mother holding my hand and thought, "Who is this woman holding my hand?" She said, "Hello, T. You have been in a horrible car accident and have been in a coma in the hospital for 45 days due to a traumatic brain injury. Do you know who I am?" I said, "This isn't funny. Who are you? Where am I?" I slowly learned about my life and who I was. I feel amazing, like I have been born again. I had to relearn how to walk, talk, make food, and discover my hobbies and interests. It was refreshing to learn about my poor diet and to change to a raw, plant-based diet which transformed my life. It was an amazing experience for which I am very grateful. Story 21. My husband was in a coma for 5 weeks. He says it was an unending series of truly terrible nightmares the entire time. There were many different bizarre plot lines, but all shared the common theme that he had to do or achieve something, or else he would die or be killed. Each scenario became a fighting for your life situation. In the last one, he was smashing down walls to escape from monsters. When he broke through the final wall before waking up, he crashed into the wall leading to his intensive care unit room. He said he looked around and saw himself there, hearing a voice in his head say, "This is reality. All of your problems are in this room." Then the nightmare stopped, and he began waking up. However, waking up was not a single event. It involved waking up multiple times, feeling confused, having us talk and try to explain what was happening, and then falling back to sleep, waking up again. Finally, he became more conscious, understood more of what was going on, and remembered what we had told him about where he was and why he was there. He then had to spend another 3 weeks conscious on the ventilator before it could finally be removed. He was completely unable to move and unable to talk. He was never alone during the entire 5-week coma, but he doesn't remember seeing or hearing anything except for his nightmares during that time. We sang to him, talked to him, played his favorite music, gave him massages, washed him, moved his limbs, and lay our heads next to his on the pillow. He was never aware of any of it. He has post-traumatic stress disorder from the whole experience, as well as a number of other health complications, but he's alive. Story 22. I have never been in a coma, but I have had seizures that put me out for a couple of days. For me, it was a total blank. I remember absolutely nothing, and there is a 2-day gap in my memory. I woke up in the intensive care unit with my head wired up to an electroencephalogram machine. I do not recommend this experience. Story 23. I was in a coma for 3 to 4 days. Felt like no time had passed. I was very confused when I woke up, groggy and making jokes about the most random things. Apparently, I was very responsive to my friends and family around me while in the coma. Now, I am dealing with the aftermath of that experience 6 years later. Story 24. My stepdad was in a 9-day coma when he was 16. He was surprised to see his mom beside his bed, as if he had woken up normally, though he was actually in a hospital and disoriented. Story 25. I was in a medically induced coma for a few days due to encephalitis, and it felt like I was being abducted by aliens. I remember lots of lights and medical environments, so my brain connected it with aliens. Prior to being placed in the coma, I recall having conflicts with the staff. I woke up heavily bruised from all of this. Thankfully, they performed a spinal tap while I was unconscious, so I have no memory of that bruising. Story 26. I was in a coma for 12 days after falling off my friend's pickup truck while goofing around after high school one day. I fell off and hit my head on the street. I was fortunate it wasn't worse. I don't remember much about waking up, maybe seeing some blurry figures across the room and then feeling confused and emotional for a while. Most of my memories from that time are a little fuzzy, even for a couple of years afterward, now that I think back. I lost a lot of weight, and it's a good story to tell at parties. My friends were great supporters of my recovery. Story 27. I remember the dream I had and thought that was life. Waking up felt like having that life. I woke up in the intensive care unit and couldn't remember why I was in this unfamiliar place. I had been admitted before I went into a coma, and when I woke up, I had no real recollection of the past several days. It took a while, but I just adjusted to the light, opened my eyes, and gathered my thoughts before I spoke to anyone. When I did, it was in very short sentences, and everyone was very patient with me. I also believe I woke up in a different room before being moved, but I can't recall the details. I would say that whole day was spent waking up and getting used to keeping my eyes open, slowly talking to the nurses, and figuring out what was happening. Story 28. Waking up from the coma felt like coming back from the dead, but without the drama I expected. Instead, there was confusion, weakness, and many moments of wondering, what year is it? It took some time for my brain to catch up to reality. Story 29. I was in a coma for about 3 weeks due to a colloid cyst in the third ventricle of my brain. The cyst blocked the fluid from draining, and at one point it grew so large that my migraines caused seizures. Essentially, my brain was being compressed by the buildup of cerebrospinal fluid. I am unsure whether it was medically induced or a combination of factors, but I remember waking up and asking how long I had been unconscious. They told me it was 3 weeks. Before that, I only recall waking up the night of the incident with an extremely severe migraine and then being rushed to the hospital in an ambulance. I was around 12 years old when this occurred. I experienced short-term memory loss for about a day and had to practice walking. It took me about 2 days to walk independently. I can't fully describe waking from a coma since all my memories from that time have come from what my family shared with me. I apparently met a character resembling Darth Vader and his stormtroopers while I was in the hospital. I want to express my gratitude to Dr. Handler at Children's Hospital, Who was the surgeon that saved my life? Story 30. My friend was in a four-wheeler accident and fell into a coma for 12 days due to brain swelling and injuries. He told me he kept having the same dream of waking up, showering, dressing in the same clothes, seeing the same people, and saying the same things. Towards the end, he began to panic as he realized he was repeating the same day over and over, which ultimately forced him to wake up. Story 31. I was in a coma in the intensive care unit for 3 days. I had a 20% survival rate, but I woke up. Right before I woke up, I saw two of my friends in a white room in front of large windows. One was sitting and the other leaning against the wall. When I became conscious, they were in those exact positions, but the room was a mint green hospital room with no windows nearby. After I woke up, I was quickly handed my phone to call my parents. I couldn't figure out my motor functions to enter my passcode. I remembered my passcode without issue. I just struggled to connect my thoughts to my actions. I was in the hospital for 15 more days, underwent physical therapy for 2 months, and had to use a walker for 3 months. I'm grateful to be alive and often wonder about that white room I saw before I woke up. Story 32. Mine was 17 years ago, and it was a medically induced coma after being hit on my bike and suffering severe head trauma and traumatic brain injury. With that part said, I was in a state of post-traumatic amnesia for 3 weeks during which I have no recollection. My wife said I was a childlike version of myself. I was 34 years old. After 3 weeks, I awakened in the middle of the day and was lucid and relatively clear-headed. I saw my brother and wife and instantly asked where I was and for a breakdown of the situation, without realizing a month had passed. Definitely, there were no lights, visions, or anything during the coma. Story 33. It took about 2 weeks before I stopped vividly hallucinating. My coma hallucinations blended with my post-coma experiences, and I am not entirely sure at what point I woke up. It wasn't like being asleep and dreaming. I remember the hallucinations as if they are real memories. I thought I was a mummy in a museum for a while. I also thought I was dead. Story 34. I was in a coma for about 4 months when I was a sophomore in high school, but I started waking up and slipping back for the last month, and it felt very disorienting. I would open my eyes to a scene, maybe say something, or a nurse would react, and then I would blink and everything would be different. New bed, facing a new direction, new people, new decorations. I distinctly remember my cousins being over around Easter, and my younger cousin asked someone if they could have something in an Easter basket. I tried to say they could, unsure if I succeeded in forming an actual sentence, and blinked. Suddenly, it was nighttime, and I was told it was 5 days later, but my little cousin did get the yo-yo. I still have moments questioning reality, but it has gotten much better over the years. Story 35. I was in a medically induced coma and was intubated. I started to come to and felt extremely disoriented by what was strapped to my face and down my throat. In my mind, it resembled the face hugger from the movie Alien. Unfortunately, I removed it. They increased my medication dosage after that and put me in restraints. When I woke up normally, it was like waking up after falling asleep. I could vaguely remember sporadic moments like a dream, but I didn't know where I was, how much time had passed, or what had happened. It was very confusing. I also had a horrible sore throat for a while after that, but I am very lucky to still be able to speak. Story 36. I could hear people around me but had no control over my body or voice. It felt like waking from a deep sleep, but there were all kinds of machines connected. Story 37. I was in a coma for 3 days. I don't remember much, but my chest was hurting significantly. I asked, "Is my chest hurting because I have pneumonia?" The doctor responded in an ironic tone, "Pneumonia? It turns out I was receiving cardiopulmonary resuscitation for 13 minutes. I don't recall anything from the 2 days prior." Story 38. I was in a medically induced coma for 2 weeks and on life support due to a serious accident. The doctor initially told me I would be blind, but fortunately, that is not the case. However, I do have some brain damage which affects my focus and causes me to stutter. It is difficult for me to adjust. Surprisingly, it felt like I was only asleep for a night. When the doctor informed me of how long I had been unconscious, I was shocked. I couldn't stand or walk after lying down for 2 weeks, and my throat was sore, making it hard to talk because of the tube inserted in my throat. Story 39. I was in a 3-day medically induced coma for cold treatment after a cardiac arrest. Waking up was confusing and scary. I remember trying to figure out where I was. It was 4 a.m., so there was no one around me. After realizing I was in a hospital, I pressed the nurse button. She arrived in a few seconds, calmed me down, and explained everything. Story 40. I was in an induced coma for 5 days due to damage from a surgical error. It was disorienting and confusing when I woke up. I was a healthy 50-year-old, but I didn't have the strength to stand up in the shower or walk down the hall. Story 41. It was disorienting and painful. I felt as if I wasn't present. This experience remains very traumatic for me. Story 42. I was in a coma for about 10 days due to COVID in March 2020 at 29 years old. As another commenter mentioned, intensive care unit nightmares are very real. I don't remember much, except for 2 very distinct memories. The first was at the hospital where I was admitted. I recall being rushed through the hallway in a hospital bed. My eyes were slightly open, allowing me to see the hospital attendants wearing garbage bags because they didn't have enough personal protective equipment. They had taken me off the ventilator, but I was still on a paralytic, so I couldn't breathe on my own. They forgot to use the hand pump to administer oxygen to me manually for about 1.5 to 2 minutes. I couldn't do anything to help myself or let them know I needed oxygen. I could feel my lungs losing oxygen, but my chest wasn't tightening as I would have expected because I was on paralytics. It was a very unusual sensation. One of the female attendants complained about how hot she was in the garbage bag and expressed that she couldn't do this anymore, saying how grossed out she was by my sweating. I had over a 104-degree fever at that point. Eventually, one of them realized I wasn't receiving oxygen and started bagging me. Shortly thereafter, the doctor arrived, looked at my vitals, and asked, "Wait, why was he off oxygen for over a minute?" Then I blacked out for several days. Note: this was all actually happening in real life, so it wasn't an intensive care unit nightmare. The next part was the nightmare. This is pure speculation, but I guess that because I got close to dying from lack of oxygen, adrenaline must have been triggered, allowing me to remember this incident. But who knows? The second incident I remember was significantly longer. I hallucinated that I was released from the hospital and flown to Wuhan to attend a COVID survivor conference. Fast forward to the second day at the conference. I was on the roof of the hotel, where attendees were having champagne as part of a big gala. The hotel was oceanside, and out on the water was a Chinese warship. It started opening fire on the rooftop, except it wasn't firing bullets. It was firing medical capsules. I heard glass shattering all around me, watched people dropping, got struck in the neck, collapsed, and died. I felt my spirit float up and away from my body, stared down at the scene below me, and saw a pink and purple light that started talking to me. It instructed me that I had died and that I had 30 minutes to tell my loved ones whatever I wanted. However, I was in China, and my loved ones were in America, so I couldn't get there to speak with them. I distinctly remember hearing my parents' voices at this point saying, "We love you. Be strong and keep fighting." Turns out that at that moment in the real world, my parents were outside my intensive care unit room calling the phone in the room, with the nurse holding it up to my ear so they could say their last goodbyes to me. So I was actually hearing them in real time but processing it as part of my hallucination. Anyway, the light told me I could use my 30 minutes to help people at the hotel. I looked down, still floating above the roof, and saw certain rooms emanating green light, which signified places where I could go and help people. I did what I could in about 3 rooms. Without getting too graphic, in the last room, I helped someone from being sexually assaulted by several men. However, in the end, I felt myself being pushed down to the ground, and the men started closing in on me. Right before they reached me, I felt myself being pulled up and out of the room. My 30 minutes were over. I floated back over and into my body, which had been brought downstairs and placed in a box without a lid for transportation. At this point, I thought that was what death felt like. Your brain would continue observing stimuli until it decomposed. I spent hours in this box being transported on a conveyor belt from the hotel to the facility where I understood the bodies were being processed for burial. Keep in mind that in real time, I was being transferred from the first hospital to the second hospital, where they planned to put me on extracorporeal membrane oxygenation. The sensation I felt of my body in this box being transported along this massive conveyor belt was actually me in the back of the ambulance. Also, that sensation of being pushed down on my stomach likely aligned with when they flipped me on my stomach at the first hospital to help with my breathing. I eventually arrived at the processing facility and understood that a machine would check your body and indicate whether you were dead, needed further evaluation, or were alive. I made it to the machine and saw it flash yellow. I remember hearing a worker next to me say, "This is Jmu Franco, his oxygen levels are at 38%. We'll need to keep a closer eye on him." My body got sent off through the facility on a multi-hour trip awaiting a secondary reading. Eventually, I got back, and the machine flashed red, signifying that I was dead. This resulted in me being transported on another hours-long conveyor belt, which I understood was taking me to the side of a mountain where there was a mass grave. I was buried, felt that same lack of oxygen sensation briefly, and then my box was unexpectedly pulled out of the ground and taken to another site. I believe the workers at this site were violating the dead bodies. I knew I was dead, but I tried with all my might to flail, as I had been trying unsuccessfully to do this the entire time, and miraculously, my left arm began flailing. After about 15 minutes of this, I heard a guy's voice say, "Dude, chill out. You're at XXX Hospital." It was then that I realized this was all a hallucination and that I wasn't dead. Then I blacked out and woke up several days later. Story 43. I was in an induced coma for a month after being in a car accident involving a landscaping truck, which I find humorous given my background as a Latino. Waking up was very strange. While in the coma, I experienced vivid dreams of my normal everyday life, which quickly turned into nightmarish horrors. I had visions of my friends and me being randomly attacked, my mother being assaulted, and myself in a wheelchair begging for help. My mother was next to me and explained what had happened. I soon realized I couldn't lift my arms or legs due to muscle atrophy. When I saw my reflection in something metal, I panicked upon noticing about 30 or 40 staples across my head. The next few weeks were nauseating. I had no motor control or understanding of anything. It was truly awful. Then came the sciatic nerve and hip pain, followed by endless sleepless nights. I was 12 then, and I'm now 31. It was all terrible. Story 44. It depends on how you define a coma, but I lost consciousness due to a vasovagal response during an examination. I went into cardiac arrest and had to be revived. I was gone for a few minutes. It was exactly like being sedated during surgery. I didn't notice anything until I woke up. There were no dreams. It felt like pressing pause on music and then resuming it. Story 45. I was in a medically induced coma for about a month on 2 occasions. Waking up was surprisingly normal. It felt like waking up from any dream, but the things I hallucinated during the coma, which are ironically my most complete memories, seemed aligned with the time I was in the coma. I don't know how to describe it other than as the longest and most complete dream I've ever had, where the timing felt accurate. It seemed like I was picking up small parts of what was happening in the hospital room based on my hallucinations. For example, my mom's friend was renovating part of her house, and I remember a contracting company coming to my hospital room to give a presentation on homes for people with disabilities. They visited a second time as well. They used a proprietary file format to take notes for each individual while the presentation resembled a PowerPoint. During the construction of this home, my neighbor was disturbed by the noise from the builders starting at 9 a.m. while he preferred 10 a.m. Consequently, he would drive a tractor around the property, claiming he could make some noise. I moved in after construction and was diagnosed with sleep apnea, starting on a continuous positive airway pressure machine. I needed to have a swallow study, so 2 nurses took me to have several barium rods inserted for an X-ray. I couldn't talk afterward, but they took me to a convenience store where I got Cherry Garcia ice cream. I had to undergo another barium swallow study later, but I wasn't able to indicate which ice cream I wanted that time. This hallucination seemed to last at least a few weeks and was not the only hallucination I experienced during that coma. Story 46. I was in a coma for 6 days. When I woke up, I was very thirsty and had a tube in my mouth. I didn't remember anything from the coma. I knew I was in a hospital, but when they asked me which day it was, I thought it was the next morning. It felt like I had fallen asleep and woke up the next day in the hospital. Story 47. I woke up, not knowing where I was, and was upset that my husband had left me in the hospital without my phone, so I couldn't contact anyone. It was strange to be upset about this, considering I was in intensive care and had no belongings with me. I called my husband and yelled at him for not leaving me with a phone. He was bewildered that this was the first thing I did after waking up from a coma, and it's somewhat funny now. Story 48. Waking up from a coma feels confusing and frightening, as some individuals recall vivid, dreamlike experiences that blend reality and unconsciousness. Story 49. I felt like I was drowning because they were removing the breathing tube from my throat just as I was waking up. Story 50. I have spoken on this topic before, but my mother was struck by a drunk driver when she was 16. She suffered severe injuries and was in a coma for 6 months, which left her with permanent retrograde amnesia. The fact that she fully recovered otherwise is a medical miracle, as her family was told she was expected to die or be left with severe disabilities due to a broken neck. She told me that when she woke up, she was terrified, knowing no one and struggling to understand much of what was said to her at first. It was like I should have known what they were saying, but I didn't really know. Not very much. She mentioned that when a doctor introduced themselves, she did not understand what a doctor was. After a while, it got easier, but she had to start over again from almost square one. Her parents discarded all her belongings. If they hadn't, perhaps those items could have helped trigger her memories, but she had nothing left. I am grateful she had many siblings who could help her fill in the gaps with what they remembered, but it took decades for any of her former memories to resurface on their own. She will never regain most of her memories, and the person she was before the accident is forever gone. But I am just glad she survived, or I would not be here. Story 51. My coma was caused by a car accident. This happened over 30 years ago, so I don't remember much about waking up except that I was restrained to a bed in the hospital. My medical records indicate that I had a Glasgow Coma Scale score of 7 for about 2 weeks. The nurse said that if I got out of bed and fell, he would be responsible. When I woke up, I could not talk without stuttering, and I was partially paralyzed. While I was in a civilian hospital for about 2 weeks, I was just in bed. I don't remember doing anything except that my mom came to visit me and pushed me around in a wheelchair for a little while. It was difficult to sit upright because my side hurt, and I was not strong enough to sit up. After some time, I was airlifted to a military hospital where I did physical therapy for a few months. Story 52. While I was never in a coma, my cousin was after getting hit by a car while riding his bike. After he woke up, he started trying to sleep with my sister. Story 53. Confusing and scary. I was in an induced coma for 3 months. I couldn't talk because of my breathing tubes. I was completely out of it, and my vision was so blurry that I couldn't tell where I was. There was a medical supply shelf in front of my bed, but my blurred vision made me think it was on all sides of me, leading me to believe I was in a storage closet. I was in a burn unit, so everyone who came in was covered from head to toe in protective gowns and masks to protect against germs. That combination made me come to the illogical conclusion that I was in a spaceship storage closet. Thankfully, after a few days, things cleared up, and I figured out what was really going on, which wasn't much better. Now, I look back at the crazy coma dreams and confusing wake-up process as kind of funny. Story 54. My sister went into 2 comas after a bad car accident when she was 19, both lasting a few days. One was induced and the other was not. She said she didn't really come to or start forming memories again until she had been out of the coma for well over a week, even though she was up and talking and trying to stand up and leave at that point. She had a severe brain injury, so it may be different if someone is in a coma for other reasons. Perhaps they would remember waking up. However, she completely lost a few weeks of time before and after her crash. I am honestly glad she didn't remember the time when she was in rough shape, It was hard to see her scared like that. I imagine it was like when I had surgery. I was already mid-conversation with the nurse when I came out of the anesthesia. My body was awake, but my brain was not recording. It was a strange feeling. Story 55. Before I opened my eyes, I thought I was home, but I was at the hospital. I was out for 4 days, and it was a bit surreal, but I handled it well. Story 56. I knew where I was right away, but my eyes felt really heavy. I felt happy and had no idea how long I had been in a coma. I don't remember any dreams either. Story 57. The day I woke up, I wasn't really awake. I thought I was in a dream, and there was a machine constantly beeping, which I hated listening to. The whole time I wanted to wake up. When I finally became conscious, I wasn't very disoriented. I just thought the dream had come true. I realized I was in a coma after a few days. Story 58. I believe the term is confabulation, where the brain tries to fill in the gaps. I was confused, and for the first moments, my brain created a reality that made sense to my 8-year-old mind. For example, I had no idea that I was in the hospital, so I was convinced that I was in a bed in the boys' bathroom at school, and the people coming in worked for the school. Story 59. I didn't want to wake up, and as soon as the confusion passed, I remembered feeling so distraught that I wanted to try to run away, but I was so weak and atrophied that I could hardly move my arms. Story 60. I was in a medically induced coma for 2 weeks. Felt like a nap, and I thought I had only been there since that morning. They bring you out of it slightly every once in a while and tell you where you are and what happened, so I knew what was going on when they fully took me out. As others have said, I had to do physical therapy to train my legs to walk again. Story 61. I opened my eyes, named all the colors on my mom's shirt, and fell asleep again. I was waking up from a medically induced coma a week after a serious car accident. Story 62. I have not been in a coma. A friend from high school was in a coma, and later I asked him what it was like. He said, "It was like a maze." Story 63. I was in a coma for 2 days, so it was not long-term or anything. My head hurt, I was tired, and I felt disoriented and confused. I almost immediately went to sleep. Story 64. I don't remember how I got there, and then suddenly I woke up in a hospital. Thankfully, I was very groggy and out of it, or I would have panicked. Story 65. Only 2 days for me, but it felt like a long sleep. When they told me what day it was, I felt a massive rush of anxiety, like my brain was scrambling to fill in those gaps, similar to after a night of heavy drinking when you don't remember parts of the night. Story 66. Time was just off. Then it was on, and apparently a few weeks later. If anything, I vaguely remember the dream, which most likely happened in the final moments as I began to wake up. The dream was just a massive, repeating vertigo experience that seemed to last forever, just before the breathing and feeding tubes were removed. But again, that was likely as I woke up. Coma is just nothing. It's all just switched off for a bit. Not that you notice. My wife maintains that I wept a tear at one point when my family joined me, but that was likely just a bodily reaction. Story 67. I had pneumonia and went into massive hypoglycemia as a result. I was in a coma for about 2 days. I didn't remember anything except one moment I was in my bed at home, and then the next, I had a nurse shaking me awake. I was extremely groggy, like I hadn't slept in 2 days, and I was thinking, just go away and let me sleep. It took about 1 to 2 minutes before I realized I was in the hospital, but I didn't care. I just wanted to go back to sleep. What woke me up was pain. I tried to roll over on my side and didn't realize that I had 2 or 3 IVs in my left hand and accidentally pulled hard enough that I almost ripped them out. That certainly woke me up. The kicker in all of this was, I woke up on New Year's and knew the date roughly, but they asked me if I knew where I was and what day it was. I replied, I don't even know what year it is. They had a television on with some channel that had a random show around 3 a.m. that was all conspiracy theories and strange topics. Like, did you know The Walking Dead was based on a true story? Confused me. Fun fact, I actually remembered something while I was in the coma. I was flying about 300 feet over an open ocean really fast, but it was almost dark and hard to see. I could only make out the waves. That was the only thing I remembered. Good times. Story 68. I fell into a coma for a couple of days 2 summers ago due to encephalitis, which is brain swelling. The cause is still unknown. Waking up from the coma felt like when you accidentally fall asleep during the day, and you wake up hot and sweaty, not knowing what time it is. Felt as if my brain was very foggy. I didn't even think. What happened? Was I just in a coma? Because I was heavily medicated. It was just a strange, foggy experience, and I didn't have the mental clarity to care about what had happened. Story 69. My friend recently emerged from a long coma. He later shared that after waking up, he couldn't understand any language he heard and was convinced that everyone around him in the hospital was speaking Korean. He has never been to Korea, does not have any Korean friends, and does not know a word of Korean. He mentioned that it took over a week for him to start recognizing words again, let alone to speak. He described that as a frightening time. Story 70. I was recently in a coma due to high sodium levels. This left me with severe amnesia. The amnesia was so profound that I didn't even remember my parents, so it felt like I was starting life all over again. Story 71. Oh man, I went into a food coma last night. I woke up at 5 a.m. with dry mouth and couldn't go back to sleep. Story 72. It's just like falling asleep and waking up. I promise it will be peaceful when you wake up. Music would be nice. Stand back when they wake up. It's unsettling and scary, and they will have questions. I experience seizures, and I am very familiar with cold compresses. Cold anything. Cold water. Sometimes, when I have seizures, I can begin to hear as I wake up from them. My heart goes out to whoever made this post. Story 73. I had extraordinary extrasensory perception after 5 years in a coma. I could see my nurse's house on fire just by touching her. Then I realized that my doctor's mother, whom he believed had died in the Holocaust, was still alive. Later, I assisted in tracking down a serial killer. Finally, I discovered a politician's malicious intention to start a world war, but fortunately, I was able to prevent that. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.